Now, the other thing that got our attention this time around was how an erectile dysfunction in men will be an indicator of poor heart health. Now, you heard that right. If a man has erectile dysfunction, there is going to be a connection with poor heart health. The thing is, the blood flow is connected with heart health, and that is deeply connected with your bed performance. Studies show this, and this is a reason why erectile dysfunction should be seen as a warning sign of cardiovascular disease. The body often sends these warning signals before a major health crisis, and one of these signs in men is erectile dysfunction. It isn't just about performance or aging. It can actually be seen as an early indicator of heart disease. Well, to talk about that and much more, I have with me heart specialist, vascular heart specialist, Dr. V.S. Bedi. Thank you so much for your time. This study says if you're having an erectile dysfunction or a problem with erection in men, it could be the first indicator of poor heart health. Tell us a little more about this study.
Yeah, so basically what happens is that the vessels in the penile area which are there are basically very small vessels as compared to the coronary arteries and rest of the blood vessels. When you have these kind of blockages in the arteries to the penis area, 25% of these patients are likely to have a coronary artery disease also, which means that basically many of these patients who have erectile dysfunction, because of the small arteries out there, some calcium deposits happen. And this happens even into the penile arteries also, as well as the bigger arteries which are supplying blood to that particular area, like the internal iliac arteries. And because of these blockages and all over a period of time, these patients do develop erectile dysfunction. And at the same time, this is what we call a mirror to the rest of the body and especially to the heart. So whenever these patients present with these kind of calcifications, we always have to evaluate them for any heart condition also, because like I said, that 25% will have a heart condition. Okay. So how critical it is, that probably we will come to know after the evaluation out there. So especially in patients who are around the age bracket of about 50 years or so, and secondly, diabetics and smokers. I think these are the two biggest causes which are there, which produce these kind of calcifications in the arteries. That means the arteries become stiff and they do not really become very compliant and all, and these kind of problems happen in these kind of patients.
So clearly what we understand is that ED or erectile dysfunction is a good indicator of poor heart health.
That's right. So that is why, like I said, that basically when these kind of patients have calcifications in the small vessels out there, the chances of calcification in the heart vessels is very high. Right. And especially if you have a combination of diabetes and smoking, and even some patients have kidney disease also for that matter. These kind of patients really are going to have a very, very high chance. In fact, when you say 25% here, the chances of having a heart condition could almost go up to 75%, and many of these patients basically suddenly present with a heart attack also. It's very common to have them coming with chest pain and sudden discomfort and all that. So erectile dysfunction is basically a precursor, I would say, to a large extent. It's an indicator also, it's a precursor also for a future coronary artery disease.